Breastfeeding Safe Weight Loss Supplements Journal, Long-Term Health Implications of Breastfeeding Safe Weight Loss Supplements. Are these your concerns? Diet plan for breastfeeding mothers to lose weight. Breastfeeding smoothies to lose weight. Breastfeeding calorie calculator. Losing weight while breastfeeding. Blog Why Can't I Lose Weight While Breastfeeding. Breastfeeding weight loss. Peak Weight Watchers. Breastfeeding diet chart for weight loss for lactating mother. What are breastfeeding weight loss synonyms? The recommended daily caloric intake during breastfeeding is 2,300 to 2,500 calories. In the case of twins, it reaches 2,600 to 3,000 calories. Aries 2016. This video highlights this benefit of breastfeeding for the health of the mother, but it is not the only one. Slow weight loss, less than 1.5 to 2 kilograms per month, through a balanced diet of at least 1,800 calories, along with the practice of moderate aerobic exercise, is considered safe for the mother and the infant. Provided that the mother does not have malnutrition problems and breastfeeding is on demand. Aries 2016, Amarim 2013, Dewey 1998. Researchers found increased prolactin levels in mothers who follow a hypocaloric diet and exercise, ensuring milk production. McCrory 1999. Of the approximately 620 calories a breastfeeding mother needs to produce about 750 milliliters of milk, only 450 calories are obtained from the diet. The remaining 170 calories come from the mobilization of the reserves of subcutaneous fat and body tissues. Butte 2005, Butte 1984, Paul 1979. In mothers who have a sufficient diet, most of the proteins in breast milk come from those taken from the diet. Modal 1998. The regulation of milk production depends mainly on the demand of the infant, being secondary age, dietary intake and maternal nutritional status. Lawrence 2016, p. 67. So that all mothers, except in extreme cases of malnutrition, produce milk in adequate quantity and quality. Aries 2016. Despite insufficient maternal intake of nutrients, women with good nutritional status produce milk of adequate quantity and quality to take care of the expansion and health of their children. Malnourished mothers produce milk of good quality. There may be a slight decrease in protein, fat and calories, but in smaller volumes. Lawrence 2016, p. 94. So that, if the dietary intake is insufficient, there is a risk of exhausting the nutritional reserves and the health of the mother. Diets of fewer than 1,500 calories are not recommended during breastfeeding. Aries 2016. There is good quality evidence that exclusive breastfeeding helps to regain pre-pregnancy weight earlier than if breastfeeding is partial, mixed, or there is no breastfeeding. And that prolonged breastfeeding helps maintain that loss and also as body fat loss. Scala 2017. Lopez 2016, Neville 2014, Samano 2013, Hatsu 2008, Dewey 2004, 2001 and 1993, Kramer 1993. I heard that breastfeeding promotes weight loss. It is true. Beyond promoting nutrition and helping to protect your baby against disease, breastfeeding can also help you lose the weight you gained during pregnancy. By breastfeeding, you use fat cells that are stored in the body during pregnancy, as well as calories from your diet, to stimulate milk production and feed your baby. Weight loss while breastfeeding can occur even if you follow the recommendation to consume an additional 300 to 500 calories per day to maintain your energy and milk supply. However, after postpartum weight loss of about 15 pounds, 6.8 kilograms, weight loss tends to occur gradually, about 1 to 2 pounds, 0.45 to 0.9 kilograms, per month for the first 6 months, postpartum, and more slowly after that period. Losing weight that is gained during pregnancy usually takes between 6 and 9 months. During breastfeeding, focus on making healthy choices. Choose a variety of whole grains, as well as fruits and vegetables, and stay hydrated. If you are trying to lose weight, limit calories from added sugars and saturated fats, such as sodas, desserts, fried foods, cheese, whole milk and fatty foods. Moderate physical activity can also help. If after 6 months of breastfeeding, you want to lose more weight, you can restrict your calories more carefully as your baby begins to eat more solid foods as you continue breastfeeding. Home-based methods to lose weight after pregnancy. You should decide to return to your pre-pregnancy weight 6 to 12 months after delivery. Most women lose half their baby's weight by 6 weeks after giving birth. The rest almost always go down during the following months. A healthy diet with daily exercise will assist you lose pounds. Breastfeeding can also help with postpartum weight loss. Take your time. Your body needs time to recover from childbirth. If you lose weight too soon after delivery, it may take longer to recover. Take some time until your checkup at 6 weeks before trying to lose weight. If you're breastfeeding, wait until your baby is at least 2 months old and your milk supply has returned to normal before drastically cutting calories. Aim for a weight reduction of about 1.5 pounds a week. You can do this by eating healthy foods and adding exercise after your healthcare provider has told you that you can get regular physical activity. Women requires 500 more calories per day who are exclusively breastfeeding as compared to what they did before pregnancy. Get these calories from healthy options like fruits, vegetables, whole grains, and lean protein. Do not go below the minimum amount of calories you need. Breastfeed. If you are breastfeeding, you'll want to reduce slowly. Weight loss that happens too quickly can cause you to make less milk. Losing about 1.5 pounds, 670 grams, a week shouldn't affect your milk supply or your health. Breastfeeding causes your body to burn calories, and this helps you lose weight. If you are patient, you may be surprised at how much weight you naturally lose while breastfeeding. Eat to lose weight. These healthy eating tips will assist you reduce safely. Do not skip meals. With a new baby, many new mothers forget to eat. If you don't eat, you will have less energy, and that won't help you lose weight. Eat 5 to 6 small meals a day with healthy snacks in between, instead of 3 large meals. Have breakfast. Even if you don't eat normally in the morning, get into the habit of eating breakfast. This will give you energy to start your day and help you avoid feeling tired later. Slow down. If you take the time to eat, you will find that it is easier to tell that you are full. It's tempting to multitask. But if you focus on your food, you'll be less likely to overeat. When you crave a snack, try to choose foods with fiber and protein to help fill you up, such as chopped raw bell pepper or carrot with bean sauce, apple slices with peanut butter, or whole wheat toast with hard-boiled egg. Drink a minimum of 12 glasses of water each day. Keep a bottle of water near where you normally feed your baby. This way you will remind yourself to drink water every time your baby feeds. Cut down on drinks like sodas, juices, and other liquids with added sugar and calories. They add calories and keep you from losing weight. Avoid products with artificial sweeteners. Choose whole fruits instead of fruit juice. Fruit juices should be taken in moderation as they provide extra calories. Whole fruits provide you with vitamins and nutrients and contain more fiber, helping you feel full with fewer calories. Choose foods baked or broiled instead of fried. Cut down on sweets, sugar, saturated and trans fats. Don't burn out on diet. Do not go on extreme or drastic diets, not eating enough, or a fad diet, popular diets that reduce certain types of foods and nutrients. These diets will probably make you lose weight at first, but those first few pounds you lose are liquid and they will come back. Other pounds you lose on a drastic diet may be muscle rather than fat. You will regain any fat you lose on a drastic diet once you return to normal eating. Be realistic. You may not be able to return to your exact pre-pregnancy figure. For many women, pregnancy causes lasting changes within the body. You may have a softer belly, wider hips, and a larger waist. Keep your goals for your new body realistic. Workout. A healthy diet combined with regular exercise is the best way to lose weight. Exercise will assist you lose fat rather than muscle. Once you're able to start losing weight, eat a touch less and move a touch more every day. It can be tempting to force yourself into a tough routine to lose weight quickly. But fast weight loss is unhealthy and hard on your body. Do not overdo it. Just a brisk walk around the block with your baby in the stroller is a great way to start adding exercise to your daily routine. My friends trusted supplements to lose weight while breastfeeding. New mothers often have the feeling that they want to lose the weight they gained during pregnancy as soon as possible, even after having a baby. Many women have 20 or more pounds, 9.07 kilograms, to lose to reach their pre-pregnancy weight. New mothers also get to decide whether to breastfeed or formula feed their baby. Breastfeeding is more beneficial of the two for the baby, as it provides long-term health benefits from the antibodies in breast milk. Although formula feeding mothers can use diet pills if they want. To try to lose weight, a breastfeeding woman needs to approach weight loss differently. Types of dietary supplements one can take. There are many types of weight loss supplements on the market, and it can be confusing to know which ones work and which ones are safe. The popular U.S. clinic explains that some dietary supplements have been banned by the Food and Drug Administration, while others are still believed to be safe. For example, the over-the-counter weight loss drug Orlistat, which is called Xenical or Ali, can cause liver damage. Ephedra and Hoodia are diet supplements that claim to decrease appetite. The popular U.S. clinic states that there is enough evidence to know if Hoodia is safe, but ephedra has been banned due to health risks. Effectiveness of dietary supplements. The effectiveness of the various diet supplements varies depending on the type of supplement. For example, the popular U.S. clinic states that Xenical is effective in reducing body fat, as it blocks the absorption of fat in the diet. Ephedra and conjugated linoleic acid may be effective for weight loss. But more research is needed. Dietary supplements that are not known to be effective, according to the popular U.S. clinic, include guar gum and the herb country mallow. Safety while breastfeeding. There is no dietary supplement that is safe for use while breastfeeding. This is because many dietary supplements cross the barrier and pass from a woman's body into her breast milk and therefore her baby. The safety of diet pills has not been tested in babies, and it is likely that they can be harmful. The pills can also cause side effects in the breastfeeding woman, such as nausea and diarrhea, which can hamper her overall health and ability to feed her baby. Losing weight when breastfeeding. Not only are dietary supplements not recommended for lactating women, they are not necessary. Breastfeeding burns calories and helps a woman lose weight naturally by taking extra energy to produce milk and breastfeed. La Leche League International states that breastfeeding women lose an average of 1.3 to 1.6 pounds per month, 0.58 to 0.72 kilograms, during the baby's first 4 to 6 months of life, without diet or exercise. Additional. The breast milk is the best food you can give a mother to her baby. But also give the breast as an ideal formula to lose weight accumulated during pregnancy. Breastfeeding is the fastest way to lose weight after delivery. Furthermore, scientists claim that the longer you breastfeed, the more weight you lose. Risks of losing weight quickly. Another reason breastfeeding women should not use weight loss supplements is that strong and effective ones could cause rapid weight loss, although some women might find it acceptable. La Leche League International states that when a woman loses weight too quickly, the amount of environmental pollutants such as PCBs in her breast milk increases. These toxins can be passed to the baby. Breastfeeding is the fastest way to lose weight after delivery. Breastfeeding helps a mother lose weight after delivery. Breastfeeding your little one is the quickest way for a new mother to return to her pre-pregnancy weight and thus prevent the risk of obesity. As stated in the Manual Breastfeeding Guide for Professionals of the Breastfeeding Committee of the Spanish Association of Pediatrics, AEP, the production of milk supposes an energy expenditure for which the organism of the pregnant mother has gone preparing in advance. In this way, this publication points out, throughout the weeks or months that breastfeeding is maintained, these reserves will be consumed until the pre-pregnancy weight is regained. The longer you breastfeed, the more weight you lose. Although breastfeeding favors weight loss in all cases, the different studies carried out in this area show a clear rule. The longer breastfeeding is prolonged, the greater the weight lost. The article Optimal Duration of Exclusive Breastfeeding, reviewed by the scientific body Centro Cochrane Iberoamericano, assesses the effects of breastfeeding in women, and he concludes that the mother's weight loss is one of the advantages of prolonging breastfeeding. According to this study, mothers who breastfeed would experience the greatest weight loss between 4 and 6 months of breastfeeding their young. In this sense, the Manual of the Spanish Association of Pediatrics also points out that the decrease in weight thanks to breastfeeding is gradual and more evident after 3 months. One of the most extensive research carried out in this area is breastfeeding reduces postpartum weight retention, published in the scientific journal American Journal of Clinical Nutrition. The study states that mothers who gain about 12 kilos manage to lose all that weight when they maintain exclusive breastfeeding for 6 months. Other benefits of breastfeeding for the health of the mother. According to data from the National Health Survey from the National Institute of Statistics, only 25% of Spanish mothers follow the World Health Organization recommendations to maintain exclusive breastfeeding for at least the first 6 months of life of the baby. This low rate, and its early abandonment, affects the child. Because breast milk is the best food that can be provided, both for its correct development and for the preservation of its health. The benefits of breastfeeding are not exclusive to the baby. Breastfeeding a child also has a positive impact on the mother's postpartum recovery. As WHO points out, breastfeeding accelerates the recovery of uterine size and tone, reduces the amount of postpartum bleeding, and minimizes the risk of breast and ovarian cancer.